Ladies and gentlemen, this opioid plague can't seem to disappear. This is a story that came from one of my subscribers, JG, Arizona Central. Despite best efforts, fatal opioid overdoses, especially heroin, surged again. The Center for Disease Control just released some new numbers, and it seems like emergency room visits and everything is soaring and getting worse. Heroin and prescription opioids drove the number of fatal overdoses in Arizona up 20% last year compared with 2016. Troubling figures that coincide with the state's highly publicized effort to confront what officials continue to say is a full-blown plague. A total of 949 people in Arizona died of an opioid-caused overdose in 2017. The Arizona Department of Health Services said in a report released this month that's 20.1% higher than 2016's finalized tally of 800 deaths. And remember, they're downplaying the numbers, ladies and gentlemen. Only 22 states report their numbers, not all 50. And more than twice as many deaths in 2012, total of 454. Heroin accounted for 51% of the surge Arizona has witnessed in the past 5 years. Health officials say heroin killed 344 people in 2017, up from 311 in 2016, and accounted for 36% of opioid overdose deaths. Prescriptions and synthetic opioids accounted for 605 deaths last year, up from 489 in 2017, according to the report. If the trend continues, officials warn that more than 1,000 people will fatally overdose on opioids this year. Arizona is faced with an opioid plague. The numbers are staggering. Dr. Kara Christ, director of ADHS, said Monday morning at a news conference along with Governor Doug Ducey and members of the Arizona Department of Public Safety. So you can see the chart here, how it starts from 2008 and it's still soaring in 2017. You can see it's still gradually going up every single year. All right, there is a video that goes to this article. So we're going to go ahead and listen to this video.
We looked at emergency department visits for opioid overdoses, and we saw a 30% increase around the country. The increases occurred in every age group of adults. They occurred in every region. They occurred in men and women. No part of the country is being spared this fast-moving epidemic. This is the second year in a row where life expectancy has decreased instead of increased. We are potentially on track to lose a generation, and we need to make sure that we work together to tackle this epidemic. Someone you know may be at risk for an overdose. We think that wider availability of naloxone to wake people up from overdoses is important. We think emergency departments can be working to help individuals who present for overdoses navigate through to the care and treatment system. And we think family members can be trained in the emergency department about how to look for worrisome signs and how to help their loved one get to care.
You know what? Having Narcan on the shelf is not stopping the overdose deaths from rising. It's not. I mean, yeah, you have it. You may be waking up the few people that you're able to get to, but obviously it is not around in all circumstances to save these folks. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And I think they are afraid to admit the obvious. They can't control this thing at all. Peace, family.